Hi, I'm Dr. Robert Roswell, the chair of the Diversity and Inclusion Task Force for the New York chapter of the American College of Cardiology. So the ACC is working on a very formidable task, which is trying to tackle and improve health equity in the cardiovascular community and the health equity that stems from healthcare disparities. So the two differences is health equity is access to medical care, and healthcare disparities may be the disproportionate cardiovascular outcomes that stem from lack of access to proper health care. In the cardiovascular community, there are many data that show that women, underrepresented minorities, do not get access to appropriate cardiovascular care. And one way of improving access to healthcare for all is to, one, increase the diversity in our workflow, and two, to increase education and knowledge about healthcare disparities in a way that we could all improve access to healthcare and improve cardiovascular outcomes for all. When you begin to tackle issues with diversity and inclusion, they have to be predicated on data. Your data has to be accurate and precise. The first thing that we're doing at the New York chapter of the ACC in terms of our diversity and inclusion efforts are really looking at our data. Who are we as cardiologists inside of the ACC, the New York chapter? So our first initiative is to really capture that. Capture the faces of cardiology within the New York chapter, really shoring up and making sure that the data is most accurate. So what we're doing is launching an initiative where we identify the demographic data of our constituents so we can better serve them. I think it would be an incorrect thing to try and apply diversity initiatives across the board without knowing if there are specific issues that we have to tackle in the New York chapter. As we know in cardiology, there's never a one size that fits all. We talk about stress tests and ischemia and revascularization modalities, and we know that we have to cater to different patients in a different manner. The same thing I would say about diversity and inclusion. We can't sort of give a one size fits all solution. So if a member were to ask what could he or she do to improve diversity and inclusion at their particular site, I think diversity and inclusion comes from all of us. So what we have to do is figure out partnership at that particular center. There are different sort of centers, there are different clinical models, different academic models, are there fellowship programs? What is that particular site doing in terms of their clinical initiatives for diversity and inclusion? And to explore, are there opportunities at that specific clinical site to partner with the hospital in terms of improving specific diversity and inclusion initiatives and tasks?